Good morning. So the topic of my PhD is the investigation of the efficacy of platelet-rich plasma treatment in chronic dermatological disorders. I'm Fanni Meznerics, and I'm a PhD student at the Department of Dermatology, Venerology, and Dermatooncology of Semmelweis University. And my vision is that patients with chronic dermatological disorders could have a better quality of life. And I would like to achieve that by finding new topical therapeutic options in the field of dermatology. Here you can see my specific goals: investigating the therapeutic effects of platelet-rich plasma in the treatment of alopecia areata of the scalp and also in the treatment of chronic wounds. And I have an additional third project investigating the clinical value and utility of multi-biomarker disease activity score in rheumatoid arthritis. So about my first project, I've already submitted the manuscript to Biomedicines, and we are waiting for the results of the review now. And alopecia areata is an autoimmune condition where we can see inflammation-induced, usually patchy hair loss. It can affect the scalp, the beard, or even the whole body, and it can lead to a serious deterioration in patients' quality of life. The lifetime incidence risk of alopecia areata is estimated at 2.1%. And regarding the treatment options, triamcinolone acetonide is the first line of treatment in localized alopecia areata. It is an intralesionally administered corticosteroid, and given it's a corticosteroid, we have some problems with this treatment modality. One of them is adverse effects, and the other one is steroid phobia, which is a more and more commonly seen phenomenon in the field of dermatology when patients fear the steroid treatment and don't want to get the steroid treatment. So when one of these problems occur, platelet-rich plasma can be a great alternative treatment option. It is a relatively new treatment modality in the field of dermatology. It contains concentrated growth factors and cytokines, which can promote hair regrowth. And it is already used in the treatment of androgenic alopecia, which is a different subtype of alopecia with different pathomechanism. So our aim is to evaluate the effects of platelet-rich plasma on hair regrowth in alopecia areata. The clinical question was that does platelet-rich plasma increase hair regrowth in alopecia areata compared to triamcinolone acetonide? The population was patients diagnosed with alopecia areata of the scalp, the intervention platelet-rich plasma injected to the scalp, the comparator triamcinolone acetonide also injected to the scalp, and the outcome was hair regrowth estimated with the help of the SALT score, which is severity of alopecia tool score. And this score shows us the percentage of hair loss affecting the scalp. They assessed it by dividing the scalp into 4 quadrants and assessed the percentage of hair loss in each quadrant. So if this score decreases, it shows us that the disease improved. So our hypothesis is that platelet-rich plasma is as good as triamcinolone acetonide in the treatment of alopecia areata. Here you can see some information about our systematic search and study selection process and the results regarding the decrease in SALT score, both in platelet-rich plasma and in triamcinolone acetonide groups, and also the mean difference between the two groups. The effect size was 1.84, which is not a clinically significant difference, and we can see that it's also not a statistically significant difference. So we can say that platelet-rich plasma is not inferior to triamcinolone acetonide in the treatment of alopecia areata. So platelet-rich plasma could be a great steroid treatment modality in the therapy of alopecia areata. It can be used in an unlimited number of treatment sessions without the increasing risk of adverse effects, and it's also an alternative in case of steroid phobia. However, further high-quality RCTs are needed to better assess the efficacy and strengthen the quality of evidence with longer follow-up periods, where we can see the further differences between the two treatment modalities and also with different non-invasive or less invasive ways of administration. My second project is the investigation of the therapeutic effects of platelet-rich plasma in chronic wound management. And I'm waiting for the results of the analysis at the moment. Chronic wounds are common medical conditions and have a high impact on the aging population. The cost of wound management is estimated to account for 5.5% of all healthcare expenditure, and chronic wounds can also lead to a serious deterioration in patients' quality of life. The standard treatment of chronic wounds is smart dressing and compression, but the special bandages which are used are not the only thing which are making the ulcer management so expensive, but also the human resources, because the recovery time is really long. So if there's an additional treatment modality which can shorten this recovery time, it's not only good for the patient's quality of life, but also for the healthcare system. So platelet-rich plasma could be this additional treatment modality if proven effective. As I've already mentioned, it contains concentrated growth factors and cytokines, which can not only promote hair regrowth, but also tissue repair and regeneration. So our aim is to evaluate the effects of platelet-rich plasma on wound healing in chronic wounds. Here you can see the clinical question. Does additional therapy with platelet-rich plasma enhances wound healing in chronic wounds compared to conventional ulcer therapy alone? And the population is patients diagnosed with chronic wounds. The intervention is platelet-rich plasma in addition to conventional ulcer therapy. The comparator is conventional ulcer therapy, and the outcomes are wound size, complete closure, pain, and recurrence rates. So our hypothesis is that additional treatment with platelet-rich plasma is superior to conventional ulcer therapy alone. So platelet-rich plasma could be a new safe, well-tolerable add-on treatment modality in chronic wound management. And also here's some information about our search and selection process. And my third project is the investigation of the clinical value and utility of the multi-biomarker disease activity score in rheumatoid arthritis. I've already finished the first draft of the manuscript, and we're planning to send it to internal review in a week. And we also have a target journal. And a bit about the background. Rheumatoid arthritis is a chronic autoinflammatory disease with a prevalence of 0.5%. The intensive monitoring of the disease activity is crucial for the treat-to-target therapeutic approach. And there are only subjective and non-specific monitoring parameters at hand at the moment, like DAS28 CRP and ESR, which are containing the subjective assessment of disease activity by the provider. So multi-biomarker disease activity score, MBDA score, is an algorithm based on the serum level of 12 biomarkers. It doesn't contain any subjective assessment of disease activity. So it could be a great objective disease monitoring system in rheumatoid arthritis. So our aim was to determine the correlation of MBDA score with conventional disease activity measures like DAS28 CRP or ESR, and also the predictive and discriminative value of MBDA score. We had several clinical questions with several PECOs. I would like to present the one which I will show you results about, how does the MBDA score correlate with conventional disease activity measures. And the population here is adult patients with rheumatoid arthritis. The exposure is MBDA score, and the comparator is the conventional disease activity measures, and the outcome is the correlation of these two scoring systems. And our hypothesis was that MBDA score shows correlations with these conventional disease activity measures. Here's the information about our search and selection process. And the results regarding the correlations of MBDA score with DAS28 CRP and DAS28 ESR, the current gold standard methods for disease monitoring. We can see here that the pooled effects are 0.4 and 0.56. So we can say that MBDA score showed low positive and moderate positive correlations with these conventional disease activity measures. So it could be a great objective parameter for monitoring disease activity. However, further studies are needed to better assess the utility of MBDA score for the assessment of rheumatoid arthritis disease activity. And here's also a summary for my three projects. The first one is already submitted. The second we plan to submit in August, and the third in June. I would like to thank you for your attention, and I'm more than happy to answer any questions.
I just have a technical question. In your third project, which of the risk of bias assessment tool did you use?
We used, I'm sorry, I haven't put this in my presentation. It was I have to check it, I'm sorry. It is partially my project. I have to say I didn't include it now, but I would like to clarify that I'm finishing this project. So not all the results are representing my work only, so.
Yeah, when you have these many projects, I mean, that's hard to follow what happens. But that's important that you should know this. I'm surprised that there are no more questions from the dentist, because, I mean, PRP is also very popular today, I mean, in dentistry, as in many other areas too. So Does it really matter that how the PRP is produced? Because there are a little different ways of producing autologous PRP, I would say.
Yes, thank you for the question. So yes, there are several ways of preparing PRP. The two main methods are the single spin and the double spin methods, and in the literature we can find the double spin method is more effective, results more effective product, and maybe you saw that the heterogeneity in our study was quite high, and one of the potential reasons for that is that in the included studies they used different ways of preparation, also the single spin and the double spin methods, and we could see that with the double spin methods the mean decrease in SALT score was higher. So that's something to consider in the future RCTs.
That was my comment as well, because my comment that how can standardize these PRP preparations. Yeah, you got it. You give the answer. Yes, thanks very much.
Thank you very much. I have a question regarding the third projects. In a clinical practice, it seems like in order to diagnose the rheumatoid arthritis, we have to check for several, like 2 to 3 antibodies. And in MBD score, we have to test several parameters. And so it's just a kind of comment. What do you think about the cost effectiveness? So instead of checking few biomarkers, if it's like quite efficient, we have to check several biomarkers. And so have you had a chance to see the cost effectiveness matters in this study? Thank you.
Thank you for your question. So yes, it's also an important aspect of this topic. We don't have results on this at the moment. There are only a few studies about this, but of course the MBD score is, I mean, the administration of this is more expensive than just checking a few biomarkers, but if it shows us the disease activity more correctly, it can be a useful tool, and the biological therapies used in the treatment of rheumatoid arthritis are also really expensive. So if we can optimize these treatments and personalize these treatments, maybe even if the MBD score is more expensive, it can be worth it.